Good afternoon. Senator Peter Micciche here with the Senate Majority, and I'm here talking to Chief Medical Officer for the state of Alaska, Dr. Jay Butler. Dr. Butler, we're here today. I have a few questions for you, and we're focused on the heroin opioid epidemic that's occurring in Alaska right now. So one of the first questions that I'm going to have for you is, first of all, how do we know that we have a problem with increased opioid use in the state of Alaska?
Well, Senator Micciche, one of the first things that called attention to the issue that we have with opioids in Alaska is increasing number of deaths due to overdose, oftentimes related to prescription opioids, but more recently associated with heroin or even fentanyl and some of the synthetic opioids.
I have with me a few of the reports. I mean, I have one from the Pew Charitable Trust that shows the heroin seizures increased substantially, started in 2007. I have, of course, we assembled and assigned an Alaska Opioid Policy Task Force, and I have the 2017 final recommendations. These are available on your website.
Yes, if you Google Alaska Division of Public Health, the main page will pull up. Unfortunately, you'll see my face, but right under that, you'll see a link to heroin and opioid information.
Your face isn't that bad, Dr. Butler. But so I also reviewed this State of Alaska Epidemiology Bulletin, which is also available on the site, and it talked about the drug overdose deaths. Not probably a direct correlation between an increase of use, but the most direct that we have. And it demonstrates that we went from a particular increase from 2010 to 2015. Right now, it seems that we are more than double the rate in the United States. Is that correct?
That's correct. While we oftentimes think of Appalachia or the New England area as having some of the highest rates in the country, Alaska is very close to being among the top 10 states. So we certainly do worry about this being a significant problem. And although we talked about overdose deaths, there's other indications as well. There's been an increase in the number of hospitalizations related to overdose, increases in the number of emergency room visits. We've also seen an increase in hepatitis C infections, which is a bloodborne pathogen that, particularly among younger people, is more often associated with self-injection drug use. We've also seen an increased number of cases of what we call neonatal abstinence syndrome. When a baby is born to a woman who is dependent on opioids, the baby can go through withdrawal symptoms shortly after birth.
One of the things I've noticed is the way I kind of say this is it used to be a problem of someone else's kids. And we're seeing some of the best families that have that connection with their children. Clearly the exposure and availability has become more of a mainstream problem. I have here the National Fire Protection Association Journal. The front page says "No Easy Fix." The title of the article is "Chasing a Killer." There are some states that have seen, particularly New Hampshire, a 2,258% increase in fatal overdoses that involve fentanyl between 2012 and 2015. Clearly, we're getting to the point of where we can define it as an epidemic, and Alaskans that perhaps don't have a family member that are struggling with addiction have seen property crimes increase. I mean, the public have seen our changes with Senate Bill 91, and then this year some of the adjustments so that we can deal more effectively with some of those property crimes. Kind of all connected.
Yes, and Senator, you obviously are very familiar with the statistics, and one of the things we often say in public health is that the statistics are people with the tears wiped away. So while we've talked about deaths and, of course, the impact on the criminal justice system and other aspects of the healthcare system, we also see families that are literally torn apart by this epidemic.
The governor has an emergency declaration that was issued on trying to, it is hard to get treatment for someone that has passed away from an overdose.
That's absolutely right. So,
can you talk to us a little bit about that?
Sure. Project HOPE, which stands for Harm Reduction, Opioid or Overdose Prevention and Education, is focused on providing education on how to prevent overdose deaths and also distribution of the drug naloxone in a formulation that's very easy to administer and can be life-saving. While it is life-saving, of course, it doesn't cure addiction. So it is just part of the approach to how we address the opioid problem. But we also need to address issues surrounding access to treatment, destigmatizing addiction, and understanding that when someone is addicted, it's gone far beyond just making bad choices, that the brain is actually altered, and that we need to understand addiction as a chronic health condition that needs to be managed as such. And we also need to address issues surrounding how we manage pain, how we dispense opioid painkillers, and address some of the issues that drive people to self-medicate for various types of lifetime trauma.
So obviously there's a comprehensive approach from your department, the Department of Health and Social Services.
Yes, sir. It's tempting to try to find a magic bullet, but my experience is magic bullets don't exist, and shotgun shells are much more effective. So we need to really take a multi-shot approach to this problem.
Does your department deal with the absence of opportunity and hope when you think about the overall approach on a healthier human in Alaska? Obviously, something is drawing particularly younger people to additional drug abuse. Is that a part of the comprehensive structure?
Well, it certainly is, and it gets to that primary prevention aspect, and particularly as it relates to addressing early childhood experiences, or ACEs as they're sometimes called. There is no single best solution there, but I think in the long term we have to continue that discussion about how do we mitigate the effects of early childhood trauma. We also need to help our young people understand the risks, that just playing with pills is not just taking granny's medicine, but these are medicines that can lead to a lifetime of problems as well as death. And I know we're all bulletproof when we're teenagers, but what I hear from many people who are in recovery now is there's a lot that they wish they had known when they were teenagers.
Thank you for that. We will be following up with the Department of Public Safety, State Trooper, and the courts to discuss this same issue. My final question for you, we have the Opioid Policy Task Force recommendations. I think the public needs to hear, can we solve this problem in the state of Alaska?
Senator Micciche, the answer to that question is yes. It's not, if I had a magic wand and could make it all go away, certainly I would do that. If I had that magic bullet, I would certainly fire it. But it's going to take all those agencies and departments of state government working together. And I'm very pleased with the incident command response that we have established that brings to the table not just health and social services, but also public safety, corrections, the Department of Law, the Department of Education, to talk about how we work together to address this problem and solve it. It has developed over a period of about 2 decades, but my hope is that it will be resolved much more quickly than that, but it will not be something that will just go away in a period of months.
Thank you for taking the time today. I'm glad you're sitting in your seat. You've been committed to the opioid problem since you came into office 15 months ago, I believe.
Something like that.
Go to the Department of Health and Social Services website. You can look for the Department of Health.
Yes.
And the reports are available. We look forward to hearing from folks around the state. I know there are a lot of task force being established in most regions. Together, we certainly hope and pray that we can deal with this epidemic and bring those lives that have been affected by addiction back to full productivity.
Absolutely. And you mentioned the community coalitions. That is where the work is really done. At the state level, we do everything we can to support those coalitions, but ultimately the solutions will be carried out, oftentimes at the local level.
Dr. Jay Butler, Chief Medical Officer, thanks for being here today. I appreciate it very much.
Thank you.